name's Corinne Freeman, and I'm going to be doing the IV, starting an IV infusion and then monitoring the infusion skill today. So first, I would make sure to prepare and administer all medications according to the 6 rights of patient and medication administration, which are right route, right time, right dose, right medication, right patient, and right documentation. Then, after I've checked all that, I would check the physician order in the MAR for the type of IV solution I'm supposed to be using, the infusion rate, the patient, any patient allergies, the type of medication, all of that information. And then after I have checked those things, I would get my IV solution according to the kind of IV solution the doctor told me to use. Then I would check that for the expiration date. I would check it for any particulates, check for any discoloration, any holes, anything abnormal that makes it seem like it wouldn't be safe to give to my patient. So then after I've checked that, I would identify my patient using 2 patient identifiers. So this is my patient today, and I'm going to identify him using his name and date of birth that I checked on his wristband. So after I've checked that, I get my IV tubing, and so I have my IV tubing, and then I'm going to label my IV solution. So they didn't give us labels this year, so I'm going to be using sticky notes. So for the labels for the IV solution, I would have my initials, the patient's name, and the date. So my initials, the patient's name, and today's date. And then I would put that on the IV solution bag. So I would put it on here, but since these are kind of big and not their intended purpose, I'm just going to place them over here. And then I would also have a time label with the infusion rate, the time the infusion began, and the time it'll take to finish. And I would put that on the bag as well, but I'm going to be putting it over here. Okay, then I'm going to get my tubing. And I'm going to make sure that this is locked. And untangle it. Oh my goodness. Okay. That's on. My thing is locked. It's untied. And then I'm going to get a label for my tubing. So that would have the date and the time. And I would put that on the tubing, but I'm just going to put that over here. So now that my tubing is ready, I'm going to take this safety catch thing off of my IV bag. Throw that away. And set this right here. Please don't leak on me. Oh, it's okay. And I'm going to get my spike for my tubing, and I'm going to take the cap off of the spike, and I'm going to make sure not to touch either one. Throw that away. Then I'm going to put the spike inside the IV bag, and I'm going to make sure not to touch it and maintain sterility. And then once I get that guy in, I am going to hang him. So, now that that is hung, I'm going to squeeze this until it's halfway full of liquid. Come on. And then I'm going to prime my line. Okay, so my line is primed. I'm going to lock this again and set this aside. Then I would get my patient and I would place him in a comfortable position. Comfortable, dependent position. I would place a linen saver underneath him or her, and then I would get my tourniquet. So I would apply the tourniquet 4 to 6 inches above the site, which isn't really possible with, I just have a hand, so I'm going to do my best. But so apply the tourniquet. Then I would palpate for a radial pulse, and if I don't feel one, then I would loosen the tourniquet. If I still don't feel it, then I would take the tourniquet off and I would just start again. Okay, now I'm going to locate a vein. So I'm going to palpate the vein that's distal. And if it's not rebounding like it should be, then I can ask the patient to open and close his or her hand. I could place a warm compress on it. I could also stroke the vein. Yeah, okay. So now I'm going to take the tourniquet off. And I'm going to perform hand hygiene. And then I'm going to put on clean procedure gloves. Come on. I have all of my supplies ready. I've got my gloves on, and now I'm going to reapply the tourniquet. Okay, tourniquet is on. I'm going to get a alcohol prep pad, and I'm going to cleanse the site, starting in the center and working my way out in circular motions. Then I'm going to let that dry, and I won't blow on it or wipe it down or anything like that. And while I'm waiting for it to dry, I'm going to get my saline wash ready. And then I would place this on a clean area. So this is clean, so I'm going to place it right here. Now that this is ready, I'm going to check my vein again. Okay, I've got my vein, so now I'm going to get my catheter. And I would choose catheter placed based on my patient, their age, the type of IV solution I'm going to be using, and the infusion rate. I'm going to take the cap off. I'm going to make sure not to touch the needle. Bevel up. I'm going to hold it with my thumb and my forefinger and hold the skin. I'm going to place this in, bevel up, and I'm going to go slowly until I get flashback. And when flashback occurs, I'm going to start to advance the catheter without the needle in it. So advance it slowly, and then once it's in there, I'm going to make sure to secure my needle and throw this in a sharps container. So that's in a sharps container. Then I'm going to get my IV lock, take that cap off, get another alcohol prep pad, cleanse, cleanse, put that on there. And then I'm going to flush the IV with 1 to 2 milliliters of saline. Okay. Okay. Now that that is in, I'm going to get my transparent dressing. Be careful not to touch it where it's going to be on my patient. place it over the IV site but not covering the port. And then I would label that with my initials and today's date and the time. Okay. Now I'm gonna get a gauze pad. Gonna place that underneath the IV. Then I'm gonna get some tape. That's way too long. Sticky side up. Place that under, and then I'm gonna twist it, and then I'm gonna twist it. And now that my IV is secure, I'm gonna get my tubing here. Get this bad boy. I'm gonna get another alcohol prep pad. Cleanse this again. Get another one. Cleanse this one. And I'm gonna connect them. Okay. Then I'm going to unlock this and it'll start infusing. Okay. It's infusing. You can see it's leaking out right here. I don't know if you can see that, but it is. So I'm going to lock it so that it doesn't leak all over my floor. Just clean this up. Obviously this won't happen for the real patient. Okay. Then, after that's all done, everything is cleaned up, I would perform hand hygiene. I would talk to the patient, make sure him or her is feeling alright, that they're tolerating the procedure well. I'm going to establish the infusion rate as ordered by the physician in the MAR. And then dispose of everything. Then I'm going to document everything, how the procedure went, what conditions I did them under, and how the patient tolerated the procedure. And that is that. Now that I have my IV in, I'm going to monitor the infusion. So first, I'm going to gather all of the important information, like the type of the IV solution that I use, the sequence, the flow rate, all that stuff. And then I'm going to make sure that all of that is correct, that it's the correct solution, it's being infused at the correct rate and time and all that. Then I would inspect the IV, and I would inspect the patency of the IV, and I would inspect the tubing of the IV. If this is a real situation, I would want to make sure like this wasn't all crinkled up like this. Nothing is kinked, and that the IV itself is still inside this vein, that it hasn't become dislodged or anything like that. Then I would make sure that the patient is comfortable, that they're safe, they don't have any questions. I could teach them about how to maintain their IV site, what to look for if something is going wrong so that they can let their nurse know, and all that stuff. And that's that. And the end.